COVID-19 vaccine will have to wait for 12 weeks before receiving the second dose. The Ministry of Health says the revised waiting period is within the efficacy parameters and is also guided by the vaccine shortage worldwide. The ministry has, however, ruled out the mixing of approved coronavirus vaccines, saying those who received the AstraZeneca jab will have to get a second dose of the same vaccine.
The Ministry of Health now says that those who received their first dose of the AstraZeneca COVID-19 vaccine have a waiting window of 12 weeks, which have been revised from an earlier 8 weeks.
The ministry has now revised the duration between the administration of the first dose and the second dose of AstraZeneca vaccine from 8 to 12 weeks. Kenyans who got vaccinated on the first week, around 5th of March, probably got a message telling them that they should come around the 5th of May. That's at week 8. Now we are telling you that we have shifted that date by 4 weeks. So if your message was coming in on the 5th of May, you count another 4 weeks.
The prolonged waiting period, according to the ministry, has been fueled by the current shortage being experienced following suspension of exportation of the jab by India to first cater for its domestic needs. The Ministry of Health assuring that the revision will not affect the efficacy and response of the jab.
Now, guidance from WHO and the current evidence shows us that taking the second dose at 12 weeks provides a higher immune response and better protection.
The science has shown that the immune response, the way your body will react to it to offer you protection, is better than if it is done at 8 weeks.
Further, the ministry has ruled out the possibility of mixing vaccines for those who have received their first jab.
You cannot get AstraZeneca today and then 12 weeks later go and get Pfizer. That is not the protocol that we are following as government. And yes, currently there are trials underway to be able to see, can you mix? But no evidence is out yet.
I am hoping they will be able to track and know half of the population. For example, if you only had 1 million doses, then once they vaccinated 500, then they need to stop and now start vaccinating, giving the second dose. But if they do one touch, I don't know then. We have scientists, we have doctors, we have people with solution. Let the minister consult.
Sentiments from the ministry come in as the country recorded 1,153 new coronavirus cases from 9,316 samples tested in 24 hours, representing a 12.4% positivity rate. During the same period, the country lost 20 patients, taking the death toll to 2,603. Currently, 1,453 patients are admitted in various hospitals, with 210 being in the intensive care unit. Nancy Okware, Channel 1 News.